So this is your favorite Dr. Kim, answering your questions about cleavage. So as a plastic surgeon, I think that my outlook on cleavage is a little different than yours. And so I'll try to sort of explain why my definition, and in terms of your breast augmentation, your breast lift, or your rejuvenation procedure, we need to speak the same language to fully understand each other. So as a plastic surgeon, when I think of cleavage, there are a couple things. One, how close the breasts are. Two, how prominent the breasts are. And number three, man-made or woman-made intervention. So the first thing is, how close are your breasts? Naturally, they should be close but not touching. Some patients lack breast tissue, some people sort of lack definition. So how close they are does determine what type of cleavage you have naturally. The other thing regarding natural cleavage is, you have to remember, without any support, without a bra, without a bikini top or underwire, your breast will naturally drop and separate, and that's completely normal. I think that what a lot of patients want regarding cleavage is something where they're wearing clothing or a special dress or a special blouse, whereas as a plastic surgeon, of course those are important considerations. However, I'm thinking more no support, clinically, what do the breasts look like? The second thing I mentioned is sort of how prominent your breasts are. And again, naturally, we all know that breasts sort of drop and fall apart without any support. With breast implants or fat grafting or a combination of both, and we can actually throw in the internal bra or other internal surgical grade maneuvers and products that can actually lift up in that direction towards the collarbone, I can generate very good cleavage, as well as put in extra material here, specifically implant, fat, combination of both, so that you can actually have fullness here a lot of the time. Now you notice I am thinking as a plastic surgeon, so I'm thinking, hey, without support, without a bra, without an underwire, we can actually have some cleavage. We can actually have some fullness here. However, as a plastic surgeon, I'm also thinking, this is a little unnatural. I think when patients talk about having that fullness there, more specifically what they're trying to say is, I want to have this fullness here if I'm wearing a low-cut blouse, a special outfit, something, and I have underwire support or some other technology, which is not natural, of course, to externally push up the breasts and push them up and push them close together. As a surgeon, I'm not necessarily thinking like that. I'm thinking, okay, what's natural? How can we have enough volume or tissue here so that if you want to wear a bra, wear some type of external, non-surgical, non-internal support, we can generate that cleavage. So I understand that this may be semantics or maybe a small distinction, but it's an important one, because honestly, having a lot of cleavage generically is a little artificial. And I think we all know that, but we have to be more specific about, hey, what do you want in terms of surgery, which is more permanent or long lasting, as opposed to, I want a natural look, but if I desire, I can also have a slightly unnatural look for certain outfits or certain times of the day. Finally, how do I achieve this cleavage? As a surgeon. So I want to pick the correct implant profile so it fits the width of your rib cage, the width of your breasts, and choose the correct implant profile in terms of thickness away from your breasts. Finally, I want to be able to do those things either with an implant or with implant and fat, or with just fat, or with an implant and fat and an internal bra, so that I can hold it up and push it up and have that cleavage maintained. So even though this is sort of a long-winded discussion on exactly what cleavage is, I hope now you start to realize that as a plastic surgeon, I'm thinking surgically. I'm thinking about what you look like with no support at all when I'm looking at you and measuring things and figuring out what type of overall look you want. Whereas what I'm thinking about, what my patients are thinking about or want, is sort of the cleavage that looks great in an outfit. And of course, they're thinking about some sort of external support, something that they can remove, like a piece of clothing, for example. But I'm thinking about internal support, and there is a big difference. So as long as we both come to that understanding, we're both going to accomplish our most awesome aesthetic goals. So I hope you found this video useful. If you have any other questions, please fire away in the comments below. Thanks so much for watching.